This is Dr. G, and I just want to share this video with you to give you some tips that have been helping my patients that struggle with severe panic and anxiety and even agoraphobia where they can't leave the house. I just got done with a session with a woman who has just that. Her pain and anxiety is so severe that she doesn't leave her home, and it's become very depressing for her because her home is kind of like a prison. And it is a very, very horrible way to live your life. And thankfully, since I use Skype to talk to my patients, I can reach out to folks that normally would never be able to show up in a psychiatrist's office. Anyway, I had just shared these tips with her last week, and she told me they were brilliant for her, and she was able to spend Thanksgiving with her son and see her grandkids for the first time, baby grandkids, because she used these tips to help herself get out of the house. So I was so excited, I had to get online and share these with you. So here's what I shared with her. When you find that your brain is starting to worry about things that might go wrong, the most important thing you can do in that moment is stop and thank your brain for sharing those thoughts. It sounds totally counterintuitive. Here you are feeling these horrible, fearful feelings, and your brain's telling you all these things that can go wrong. What most folks do is they start to argue with themselves or they start to spiral. But what I want you to realize is that these anxieties and fears are coming from a part of your brain that's trying to protect you. Kind of like a mom who's afraid of her child taking the bus or going to a sleepover where he's going to be away from her and she won't be able to see what's going on with him. If a mother gives into those fears, she's going to become an overprotective parent and actually hurt her child. But it's okay if she has those fears, but then lets her child grow and learn anyway. Well, that's the same part of your brain that's trying to take care of you. And the more you give into those fears, the worse your life becomes. But what's really important when you're trying to heal is to acknowledge that that part of you is trying to love you and trying to take care of you. And so the first thing you do is you stop and you say, thank you for sharing. Now, what my client told me is that when she said thank you for sharing, it felt sarcastic to her. It didn't feel loving. And it's very important that this is done in a loving way. So she changed it to thank you for caring. And to her, that felt really authentic and loving. And it really helped her in the moment go from feeling very anxious to feeling loved and more calm. The second step that's very important is as soon as you say that to yourself, you immediately distract yourself with something that gives you pleasure. So for her, she's been watching YouTube videos where Seinfeld is interviewing celebrities in a car while they get coffee. I don't know exactly the details, but she says it's hilarious, it makes her laugh, and she feels good. I have other clients that distract themselves with games, with Facebook, with calling a friend, with singing a song, because it's really hard to sing and think at the same time. But it's a very important part of this process because as soon as you thank yourself for caring or for sharing, you want to stop engaging in that whole thought process and immediately reward yourself with a distraction you find pleasurable. If you start practicing these two things together, it will make a difference in your level of anxiety and your ability to get out there and do what you need to do. It's a really important first step because what you need most when you're suffering with anxiety is to give yourself the same love and understanding that you would give other people and that you deserve. I hope you do it. I hope it helps. I hope you get out there and enjoy your life. This is Dr. G. I'll see you soon.